Good evening. My name is Melissa Ganton, and I'm the Executive Director of St. Mary's Health Clinics. We're grateful to have you here this evening. St. Mary's Health Clinics is a remarkable ministry of the Sisters of St. Joseph, serving the unmet healthcare needs of those individuals in our neighborhoods. We could not do this important work without your continued support. From our volunteers to our community partners, and from all of you donors and supporters who give generously to keep our ministry alive. Tonight, we will be highlighting the volunteer doctors and nurses who give freely of their time to provide quality access and health care to those people in our community. Thank you for watching and enjoy your evening.
She's approximately a 50-year-old woman, Spanish-speaking. She works in a restaurant, presented to us after having gone to a number of clinics. And like many other people, heard of us and said, well, I'm going to St. Mary's Clinic, and showed up with an interesting problem that was prolonged bleeding or blood in her stools. And it had been going on for some time. The one test that she needed was a colonoscopy. We set her up for the colonoscopy. She had the colonoscopy, and lo and behold, the individual did have cancer. Through Park Nicollet, she got involved with oncology. She got involved with surgery. She got involved with post-op. She had surgery, and she's right now in remission.
It was marvelous how a group of nuns put together a network of clinics throughout the community, in churches and schools and various small outlying buildings, and set up that care system, and then soliciting the volunteers to be able to manage or provide that health care.
I think that healthcare is a basic human right, and the patients that I've seen are hardworking patients who deserve to have healthcare. If we can provide anything that makes their lives a little bit easier, it's important to me to do that. I've been given opportunities in my lifetime, and this is just one small way to give back to the community, or to show that my beliefs about healthcare being a basic right. I'm going to try to show that by continuing to volunteer.
I primarily see nurses and Spanish interpreters, and then the folks who work at the registration desk. I don't tend to see the other physicians because we work one at a time, but I see people who could very easily be taking an afternoon off from their work, but they've come to the clinic to volunteer.
This one patient that I may be seeing for the day, giving her or him some tools, medication, a listening ear, bringing that to their home. I'm hoping that better health care for this patient is better health care for their family. So I just see that each of us as a person, of course, is highly connected to our community. And the healthier people are, mental and physically, the healthier our communities are going to be.
I think we're beginning to recognize the type of patients we're seeing here many times have sometimes simple needs, coughs and colds, but many times have some complex needs. Thankfully, we have a good staff here, the nurses in particular, that are able to recognize stress, depression.
If St. Mary's Health Clinics didn't exist, I would be really worried about patients having to use inappropriate spots for their health care, like an emergency room. And I believe that when it comes to chronic care, the emergency rooms are not the right place for that. Patients who have chronic care need a home base and need a clinic that can provide refills and prevent crises. And without St. Mary's, I know that patients would have to use acute care, urgent cares, and emergency rooms. And not only is it not okay for the patient, they're not going to get the best care. for their diabetes or high blood pressures. It's going to only be a Band-Aid or a quick fix. But when we're thinking about total cost of care in healthcare as the big picture, this is not a good way to use our resources in medicine. So St. Mary's Clinics, in my mind, is essential.